Hello, Dr. K. Thank you for joining us today.
Hi, thank you for having me back again.
Of course, Dr. K is our System Medical Director of Infectious Diseases, and she is amazing, and we've enjoyed many sessions with her. So thank you all for joining us today. I know that you'll learn a lot from her. I do every time I speak with her. So we'll start off with milestones of the COVID-19 vaccine. There have been a lot of exciting announcements recently, and we'll also answer your questions. So you can drop those in the chat as she's talking, and we will circle back to your questions probably about halfway through the session. So let's go ahead and get started. There have been a lot of milestones. Tell us the latest.
All right, here we go. So August has been such a big month in terms of milestones for the COVID vaccine. So today I'm going to talk about 4 of them. So it's action-packed. So first, and they're actually not in order, I'm just going to talk about the first, I think is the biggest one, is that on the 23rd, so on August 23rd, which is on Monday, Pfizer's vaccine was given full approval by the FDA. So what does this mean? This means that for people who are over 16, this vaccine has gone through the same rigorous testing regulatory process as any other vaccine out there. So it has gone through phase 1 studies, phase 2 studies, and phase 3 studies in around 40,000 people. And we have 6 months of efficacy and safety data in this group. So 6 months after the second vaccine, we have data in this group. So now the process was not rushed. We had FDA work, public officials working kind of across time, like through time, like working very hard to make this happen. And so this is now what's happened. So what does this mean? So what this means is that now health experts are hopeful and encouraging all individuals to get the vaccine. And they do that kind of because there were definitely people who were holding out while the vaccines were in this EUA process. And now, they can go ahead and they can go ahead and get the vaccine with more confidence that there's safety and efficacy data. So 1, we are hopeful that many more people will get the vaccine. 2, what we'll see across the board is that more institutions, so more universities, more healthcare systems, more companies, more government agencies like military will now be emboldened to issue vaccine requirements or mandates for their workers. So I think we see this kind of much more across the country now that for the safety of the workforce, that these institutions, companies, universities, healthcare systems will have requirements for vaccine. And so those are 2 big things that will happen. And then finally, what we hope will happen is that doctors, nurses, the community, what we call our COVID community core, will be emboldened with more data and more evidence to recommend this vaccine to patients, to loved ones with more confidence. So those are 3 things that we hope will happen now that this vaccine has gotten full approval. So I wanted to mention that it will be branded as Comirnaty. So Comirnaty. It's a tricky one, and this is why it came about to be this name. It's actually a mashup of a few words. So the CO is the COVID, the MIR is a play off mRNA, and the NATY at the end is a play off the words community and immunity. So you'll hear that a lot now, Comirnaty. And then to just share a little bit more, like in terms of timelines with you. So on December 11th, Pfizer applied for the EUA. Then on May 10th, it applied for EUA for 12 to 15-year-olds. So by the way, this full approval is not for 12 to 15 age group, it's for over 16. And then on May 7th, it filed for full approval. So Moderna applied for the EUA on December 18th. And then on June 1st, it applied for full approval. So it's kind of 3 weeks behind Pfizer. So likely it will in the next month also get full approval. And so that will happen as well. So that's milestone number 1. Milestone number 2 is that on August 12th, the FDA permitted COVID vaccine boosters for people with weakened immune systems. So what this means is that, our most vulnerable with weakened immune systems will hopefully get an extra shot to protect them against COVID. So why did this come about? This came about because in studies, for example, in transplant recipients, not everyone who got the vaccine developed antibodies. So what we say in common jargon is not everyone took to the vaccine. The vaccine didn't really work. So then now, both for Pfizer and Moderna, a third shot is approved by EUA, by emergency use authorization, for 1 month after the second dose. So you would get, for example, you would get Moderna at month 1 and then month 2, because that's how it works. And then the third vaccine would be at month 3, 28 days later. So you may ask, who falls in this group and do I fall in this group? So people who fall in this group are solid organ transplant recipients, stem cell transplant recipients, people who have had cancer or are on chemotherapy, people with primary immunodeficiency disorders, and then people who are on immunosuppressive medications, and then people with advanced or untreated HIV. So you may ask, so I was actually at a phone call when the CDC was explaining the rollout of the boosters, and many doctors, many healthcare workers were asking, well, what defines an immunocompromising medication? What is advanced HIV versus, HIV that's well controlled? How long do you have to be on these medications to call yourself immunocompromised? And what the CDC health officials said is that this is a very nuanced topic. So really, it is if your clinician with clinical judgment thinks that you have a weakened immune system, then you are able to go get the third vaccine. And so how do you do this? Do you need a doctor's note? So actually you do not. It's through a process called self-attestation. So you would go to a pharmacy or employee health, and you would say, I have a weakened immune system. I need the third shot, and then you will get the third shot. So that is what we know about boosters for weakened immune systems. And then also I get asked a lot, is it the same vaccine? So it is. So if you got 2 doses of Moderna, the third would be Moderna. If you got 2 doses of Pfizer, then the third would be Pfizer. We actually don't know the recommendations for Johnson & Johnson yet, so we are waiting for them to come out. So that's number 2. So number 3 big announcement was on August 18th, and that was a joint statement from the Department of Health and Human Services and medical experts saying that there will be an opportunity, or there will be a recommendation for individuals, all Americans, to get a third booster vaccine 8 months after the second shot. So this is different. This is for all Americans, all comers. And why did this happen? So this is actually a little bit different from immunocompromised people. Actually, people, quote, took to the vaccine. People developed antibodies. In 6 months in trials, people still had, these antibodies were still, 90th percentile efficacious in protecting against COVID. But what we've seen is that, as with many vaccines, the protection after 6 months can go down a little bit. And so, the health experts are trying to account for this bit of it going down. So in these individuals, the vaccine worked, it took, but, as naturally happens, the amount of antibody goes down. And then the other thing is that now we have this Delta variant, and we've seen that the Delta variant in general has decreased efficacy, sometimes from like 98% to 60% in all individuals, just because of what the Delta variant is. And so this is a very proactive approach by the government and health experts to get us in the safest position and get us ready. And so that came out August 18th, and actually yesterday, which is yesterday the 25th, there are reports saying that the recommendation will be changed, that it might actually just be 6 months after your second dose. So more to come on that. That's kind of rapidly evolving. And then, Pfizer has put out there that they've done a study of 306 individuals looking at this booster shot and people who got the booster shot in 5 to 8 months. And they found that the level of antibodies jumps more than 3 times higher if you get the third booster. So that's number 3. So number 4 in exciting news about this vaccine is that the FDA actually went ahead and approved the vaccine for use, or not approved, I'm sorry, recommended the use of this vaccine for pregnant and breastfeeding women. So before, even though many associations relating to OB-GYN and maternal medicine had actually recommended it, the official CDC recommendation just came on August 11th. It came based on the growing data about the vaccine in pregnancy. And so the growing data is that we have not seen safety concerns in animals, and then we haven't seen safety concerns in the individuals who've already gotten the vaccine. We have seen, the data is kind of out there on the mRNA COVID vaccines, that there's no increased risk of miscarriages, there are no adverse outcomes. So based on this data, they've kind of gone ahead and pushed this. Also, they have, consider the fact that women who are pregnant get more severe disease. And what more severe disease means is that disease that leads to you needing a ventilator, a hospitalization, or even death. So weighing the benefits and the risks, they've kind of now gone ahead and given their recommendation on that. Also, there is this thought that vaccination of pregnant people builds antibodies that might protect the baby. So there are studies that have found that there are antibodies in the umbilical cord blood, which may be protective in babies. And so we're waiting for more data and more studies to tell us about this. And then another thing about this recommendation that it's also come because the South has been seeing unprecedented numbers of pregnant women who are critically ill. So, that is, it's all this data together, all of these real world happenings. And what does this mean? What this means is that there might be a change. I talked about now more vaccine mandates are coming, and that's kind of what we'll see in the next couple of weeks. Well, we'll also see more and more that pregnant women who were previously kind of excluded because the CDC had been not fully given their recommendation, well, now they'll be included with everybody else. So there won't be kind of special exemptions for pregnant women. So we'll be seeing that across the country as it comes to vaccine mandates. So that is what I have in terms of our 4 big milestones. So milestone number 1, which happened latest, Pfizer got approved. Milestone number 2, immunocompromised individuals can go get a booster at 1 month after the first 2 shots. Number 3 milestone, we are waiting on the full recommendation, but it is most likely that all Americans will be getting a booster at either 6 to 8 months after their first 2 shots. And this is expected to roll out actually at the end of September. So September 20th is when the current word right now. And then number 4 is that the CDC has aligned with all other organizations like the American College of Obstetrics and Gynecology to say, this vaccine is recommended in pregnancy.
Awesome. So much great information. We appreciate it. We already have questions coming in based on the 4 things that you talked about. And we also had questions submitted before today's session. So I will hop in. This is a great question, actually, with flu season coming up. Would the booster and the annual flu shot need to be spaced out? If so, how long would you need to wait between the 2?
That is a great question. So I'm so glad you asked it. There is no spacing out. So you could actually get the flu vaccine the same day as your COVID booster and be just fine.
Perfect. And just a heads up, here at Baptist Health, I know this is underway and appointments will be rolling out soon. But for those who haven't received their COVID-19 vaccine yet, and those who need to get their flu shot, we'll be running hybrid clinics where you can come get both. So one time for you to come in, and hopefully that's convenient for everyone. So that's a great point. You can get your flu shot and your COVID vaccine at the same time. Question from the same person. Do we have an idea of when kids under 12 will be approved to get the vaccine?
Experts are hopeful that it would be towards the end of this year, so December 2021 or the very beginning of next year, just based on how their studies are going. Their studies, both Pfizer and Moderna, started in March. So again, we'll need like 2 months of safety data after the trial started. So we're targeting the end of this year, the beginning of next year.
Perfect. So I think this is in relation to the booster information that you talked about, but if a person had chemo years ago, would this apply?
Right. So this is kind of exactly what the CDC health officials had to answer. And so what they said is that it would be a clinical judgment for your doctor to make. So based on where you are right now, either your primary doctor or your oncologist could, weigh in and either suggest the vaccine or not. And though it doesn't fall into the exact criteria, right now, you could still get a vaccine if they thought you had a weakened immune system.
Okay, perfect. This is actually a personal question based on something I saw in the media, but I think when boosters are available, it's like for those of us who really want to be protected, people feel like they want to get a booster right away. But what's the benefit to waiting that 6 to 8 months versus the boosters are available? Let's go get one, even if it hasn't been in the right timeline.
So yeah, the reason we're going to wait 6 to 8 months is actually because you have very good immunity up to 6 months. That we've seen in studies. So it's that you really don't need it. And the way it was studied like the studies were like from 5 to 8 months. So we don't really have data to say like if you got the vaccine 4 months ago, is it really safe to go like 3 months later in everyone else and all other Americans. So that's the benefit of waiting the timeline, because one, you don't really need it, and then two, we didn't fully study it that way, giving it earlier.
Gotcha, perfect. We've had this question a couple times. This is a really interesting one. What are your recommendations to encourage people that are afraid to take the COVID vaccine? How to talk to people who might be on the fence?
Sure. So I am a big believer in vaccines, and I know that people are scared and hesitant, but there is so much data, like a plethora of data right now that says they are safe and effective. And then on the downside, if you don't get it, there is high mortality, especially right now in Florida when it comes to COVID. So, there is very little reason to not get the vaccine. So other points to encourage you to get the vaccine are healthcare workers, especially in southern areas, which are hotspots. They are exhausted and our hospitals are at capacity. So please consider healthcare workers when you make this decision. Then consider community, right? Because unless we all get vaccinated, really the vaccine won't work as well. That's what herd immunity means, that everyone needs to get vaccinated so that the vaccine isn't circling it around and making variants in people who are unvaccinated. So it's for our community. And then finally, it's for, because I have two of them, it's for children, because children, they will not be able to protect, they can't get the vaccine right now, so they can't protect themselves. So I hear many times, hey, I got COVID and I did fine, or I will probably, I'm young, healthy, I will probably do fine if I get COVID. But the sad part of that is that not everyone will do fine. So it's just thinking of yourself too, because it will protect you, but also of everyone else who, will not necessarily be fine if they get COVID.
Thank you. Is Baptist Health testing specifically to find out if a patient has the Delta variant, or do the symptoms tell you what the variant is?
Sure. No, actually, we have a certain percentage of our our samples are sent to state lab to get identified. So we actually get a percentage later on. So like we won't know if someone's admitted, we won't know during the admission, do they have Delta or do they not have Delta? But later on, we take that our labs to the health department, and they're able to quantify how many are Delta and how many are not. And in the past weeks, the majority, over 80 to 90% have been Delta.
Thank you. So similar how to talk to others. I love that a lot of people on this call are just soaking up all the knowledge to be able to talk to others, friends, family, patients. I think that's so great. So what's the best approach to ask people to keep wearing masks even if they're fully vaccinated? Maybe there's a study you could cite or some data you could provide on that, just how to talk to people about why they need to wear masks.
Sure. So there's definitely data on why masks work. So there's actually data kind of in a lab looking at respiratory droplets. And so this data kind of looked at masks and used a machine that kind of simulates droplets and found that, these masks do protect you. So that's data in a lab. And then there's real world data. So, for example, there's like evidence of someone who flew next to a whole group that didn't have COVID, and he wore a mask and he had a dry cough. And then they tested everyone else on the plane and no one got COVID. And there are many examples like that of real world data where if you wear a mask, you can prevent the spread of COVID. So there is data, and I can actually, if you like, I can give you the studies about the lab data and then even the real world studies. But masks, they do work. So if you are like right now, when we're in high transmission areas, we are supposed to be masking. And in schools, there is a recommendation to mask from the American College of Pediatrics.
Perfect. Thank you. So we have two questions related to when you can get the vaccine if you've had COVID or if you've been around someone who tested positive. So the first question is, if you've tested negative, but you're living with someone who tested positive, when can you get the vaccine?
If you test negative, but you're living with someone with COVID, you can get the vaccine. If you tested negative, you can go ahead and get the vaccine. There's nothing preventing you from getting the vaccine. If you are living with someone who has COVID and you are caring for them or you're around them, another option for you, which is not this lecture, but another one, is that the monoclonal antibodies have been approved now for prevention. So that's another thought out there as well. And you can get that whether you're vaccinated or not. But certainly if you're living with someone with COVID or who just had COVID or who has long COVID, which means still has symptoms, you could definitely still get the vaccine yourself.
Perfect. Thank you. Great point about the monoclonal antibodies as well. So if you receive your first dose of the vaccine and then you have COVID, and you're positive when your second dose is due, can you still receive the second dose?
Yes. So if you get COVID, you will likely stay positive. Your PCR test will likely stay positive for the next 3 months. That doesn't mean you're infectious. That means like there are little parts of the virus that you don't clear, like not that you're infectious, but little debris, we call it, of the virus that could stick in your nose and that could make you test positive for 3 months after that. So let's say you get let's say you get one vaccine, then you get sick with COVID, and then you're wondering, what should I do after that? You should still go back and get the second vaccine. And the amount of time you need to wait, and this is whether you had the first vaccine or not, once you get COVID, you just have to wait for your symptoms to clear. So you have to be afebrile. And then you have to wait either 10 days if you have mild to moderate COVID, or 20 days if you have severe COVID or are immunocompromised. So most people are okay going to get a vaccine 1 month after they've had COVID. Most people are cleared by that point.
Perfect. Thank you. So we have some other questions in the chat that I'm reading right now. This is a great question, and it's a question that we had a whole session on a couple weeks ago. So there's a lot of good information out there, but it's a question that we should definitely address. It comes up often. Why would you need the vaccine if you already had COVID and have the antibodies?
Yes. So this one's becoming one of my favorite topics because I gave the first WebEx on that. So we don't know enough about natural immunity. We don't know enough about natural antibodies to say that they protect you from COVID. Whereas we know plenty about the actual vaccines and the antibodies they generate and their protectiveness against COVID. So for example, we don't know if you had mild disease and you got, COVID mild disease, does that mean you have fewer antibodies? Like, what does that mean? If you had severe disease, does that mean you have more antibodies? We just don't know enough. And then on top of that, we don't know how long the natural antibodies last either. They could last anywhere from 3 months to 1 year. So we don't know we don't know enough about them to say that they would protect you against COVID. we don't know enough about them to say that they protect you against Delta either, whereas we know that in terms of the vaccine. So we have a lot more information about that vaccine and how they protect you. For example, we know that there's a part of, we know that the vaccine targets a certain part of the spike protein, and that's why it works. So things like that we know about the vaccine, we don't know about natural immunity. And then what the other thing is, based on studies that have been done, if you actually get COVID and have natural immunity and then you get the vaccine as well, then you have something called hybrid immunity, which is even better than if you did not have COVID. So you're actually in the best position to protect yourself if you've had COVID and you still get the vaccine.
Awesome. A question we also hear a lot, I often hear people in the community, patients say they're hesitant to get the vaccine because they don't know the side effects of the vaccine 5 to 10 years from now. How would you respond to that?
Sure. So we don't know the side effects 5 to 10 years from now, but we have a history of vaccines. So we know that in the history of vaccine, all the major side effects that happen, like the Guillain-Barré syndrome, the paralysis, those types of big side effects, they all happened 2 months after the vaccine. In fact, to get emergency use authorization, the FDA looks at 2 months for that reason. 2 months is really special. That is usually when most people develop their significant side effects. And there aren't vaccines in history where we can look at them and say, okay, that we got that vaccine, year 1, and then 4 years later there was a huge side effect. Actually, that hasn't happened in the history of vaccines. So the majority of the side effects will happen within 2 months. And that's why with confidence, I can tell you to go get the vaccine and that you will likely not have some crazy, unusual side effect that happens 3 to 5 years later.
Perfect. Thank you. For those who can't type in the chat, I wanted to give anyone who's calling in on the phone and who may want to ask a question the opportunity right now to go ahead and unmute and ask a question. All right, we can go back to some other FAQs that we've seen come through. Can you talk just a little bit about the ingredients of the vaccine?
Sure. So the vaccines, they have, gosh, I have this pretty picture here, but they have lipid nanoparticles which surround the vaccine, and that's because the mRNAs they're not stable on their own. So these protect the vaccine from being degraded. There are sugars, there are salts, there's water, and then there's acidity regulator so that the vaccine is just right for the environment. And that's those are the non-technical terms. If you want the actual ingredients, they would be in the CDC website as well. You'll probably see a lot of words that you don't recognize, but that's really all they are. They're salt, sugars, acid regulators, and water, and then the mRNA inside.
Awesome. We have 2 minutes left. I'm going to ask you a little bit more about monoclonal antibodies since you touched on that, and it's a big topic right now, especially in Jacksonville. So tell us a little bit about who would benefit from monoclonal antibodies and just any information that you have for the last few minutes.
Sure. So first, I'm going to start off by saying this. The vaccine prevents COVID. So the monoclonal antibodies and vaccines, they're kind of very independent of each other. So vaccines are what prevent. So let's say now that you get COVID, well, then you have this option, which is called monoclonal antibodies, which are actually excellent. So they are, we've talked a lot about antibodies, and antibodies are, are your defense system that you develop when you get an infection. So in lieu of that, you can get something called a monoclonal antibody, which is something derived in a lab, and all the antibodies, it's called monoclonal, they're kind of the same and they target the same thing. And so these monoclonal antibodies target the spike protein of coronavirus. And you can get that if you've been exposed or if you have 10 days of symptoms and you have mild to moderate COVID. So if you get COVID, mild to moderate, you can go to one of our either Baptist infusion Baptist infusion center or one that we have around the city to get this monoclonal antibody. It's what it does in studies is it prevents progression to severe disease. It prevents progression to hospitalization and to death. So it's a very good option for individuals who are early in their disease. And then you typically have to have one risk factor. And risk factors are like if you're overweight, if you're over 65, if you have some heart disease, lung disease, sickle cell, a neurodevelopmental disorder, or mechanical dependency like a trach or gastrostomy tube. But actually many more individuals qualify than you would think. You don't have to have it's just a BMI over 25 for being overweight, so or over 65, and then you're early in your disease within 10 days of symptom onset. You can try to get these monoclonal antibodies. And then another area is if you're likely to develop severe disease and you've been exposed. So then if you're someone who can progress and you just, not that you have it, but you've been exposed to someone else, then you're a candidate also. That's called post-exposure prophylaxis.
Perfect. Well, we are at 12:30. I've learned so much from you today. I appreciate everyone for joining us, and especially Dr. K for being here to answer our questions. So thank you so much.
Thank you again. Please reach out to me if you have any questions.
Perfect. All right. Have a great day, everyone.